This is 𝗨𝗲𝘀 in Karachi, Pakistan, and you are watching my channel, Knowledge for Quality of Life. Friends, I apologize that I'm late. A couple of days since I was traveling and I came to Karachi, Pakistan to attend a wedding of my friend's son, and I didn't get a chance in hustle bustle of this wedding, which is still going on for 2 more days, and I couldn't do the vlog. And there's an internet issue as well in this part of the world. Electricity issue itself is a problem, and internet connectivity is a problem. So I couldn't upload the way I used to do from Chicago, Illinois. But anyways, today I wanted to talk to you about something which is the breast cancer, but I'm not going to do it because I'm not in Chicago and I don't have the laptop capability and a lot of other references which I wanted to share with you. I don't have it with me, so I'm going to be doing something else which is very crucial in its own respect, and that is lipid panel for the cardiac risk. I've been to many forums and I've been hearing about this issue. A lot of people track their lipid profile. Majority of the time they are very freaked out about LDL and all that jazz, particularly total cholesterol and all that. Over the years, I was in the same boat, but since 2016 I focused on certain things of multiple variables of lifestyle. And I found out that the 2 parameters which are very crucial, which is part of the metabolic syndrome. If you look at my vlog which I did on metabolic syndrome, there are 5 parameters, and if one satisfies 3 out of 5 parameters, one would declare that so and so has a metabolic syndrome. And actually metabolic syndrome is the biggest driver for insulin resistance. 2 of those parameters for metabolic syndrome out of 5 is triglyceride and HDL. Now, when you look at the normalcy of triglyceride and HDL, it's a little bit tricky. So if anybody has a triglyceride under 150, they say that it's normal, but that's pretty generous. And I'll share my story with you, why I'm saying that. And if someone says that, for a male, if HDL is up to 40 and above, that's normal. And particularly for female, it should be normal by 50 or over. That's the guidelines. So let's say if I take the normal triglyceride, which is 150, and if I take the normal HDL, which is 40, and if I divide triglyceride by HDL, 150 over 40, that's going to give me a little bit 3.75 or so ratio. So one of the parameters which is a very, very predictive parameter for cardiac risk is triglyceride to HDL ratio. So I'll share my story with you, and I have shared in other vlogs in different categories. When I talked about my HDL, for years it was low, and particularly a lot of people are in the same boat. Their HDL is low. I had for years and years around 27, and it was not budging. So, and my triglyceride was always around 90-95. Way below 150. So if I take 90 over 27, my triglyceride over HDL ratio was around close to 3.3 or close to 3.5 sometimes. Now, historically, the data says that triglyceride, when it's above 2, the small LDL particles, which are very small surface area particles, which are part of the lipid panel distribution, which gets oxidized pretty quick, they are bigger part of the plaque formation, which we call atherosclerotic plaque. And the process is called atherosclerosis. So my objective was to bring this ratio as low as possible. And they said that, if you keep that ratio under 2, it's ideal. It's pretty good. It means that, your triglyceride divided by HDL ratio should be less than 2. So mine was around 3.35, 3.5, and my objective was that bring the triglyceride down and bring the HDL up. Now, HDL is a marker of, one of the marker of the metabolic syndrome, and for male, it's tied to your circumference of the belly. A lot of people I see that they carry a lot of visceral fat, the males particularly, and females has visceral fat in the thigh area and the buttocks. So the crux of this issue is that if you lower your consumption of the refined flours, sugar, and all the sweet stuff, which has a lot of carbohydrates, and that carbohydrates especially turns into, particularly simple carbohydrates, turns into glucose, and that drives your triglyceride high. So my objective was to cut down as much as possible my simple carbs. When I say simple carbs, means refined sugar, refined flours, all the sweet stuff, all the pops. I never had pop in my life, for the last 50 years I recall. So I had to lower my consumption of the carbs, simple carbs, and in doing so, I have to do the same thing with my increase in the HDL, so I can bring this ratio down as much as possible. Now, you should see my vlog that how I unlocked my HDL by studying Dr. William Davis, author of the 𝗣𝗿𝘀𝗀𝗍 book, and renowned cardiologist. And I fixed my vitamin D 60 and above, and let it see my HDL go up and up since 2016. So my HDL was 27, and my vitamin D level was 20 at that time. And my objective first was to take my vitamin D level in the blood serum from 20 nanograms per milliliter to at least 60 and above, and wait about a year or two, and in doing so, eliminate all the refined carbs and sugars and everything. So eventually my HDL started increasing, from 27 to 33, and then 44, 48, 54. The most recent I got last April was 64. Now my current HDL number is 64, when my vitamin D level is hovering around 95, 98. So still it's going up. I don't know where it's going to, plateau my HDL level. But if I take 64 and, by eliminating refined carbs and sugars and all that, my triglyceride dropped from 90 to 45. Now, if I take my ratio now at this moment, my triglyceride is 45, and divided by 64, which is my HDL, my ratio is less than 1. And they say optimum is less than 2. I brought it down from 3.5 to around 0.7, 0.8. That's a huge number, downwards. In doing so, I dropped my small LDL particles, which was once 700 in 2016. It's hovering around 180 now. So that's about 73% drop. I don't know any drug is out there which can have this kind of a reduction. And this is purely lifestyle. I'm going to be 65 next year, and I'm not taking any prescription meds. So far, so good. It's with the blessings of God Almighty. And just few supplements which I have shared in the past. And if you are interested, I can share those supplements and the names again. But it's a discipline. It's a lifestyle discipline, and that's what I've been doing. So the cardiac ratio, which is TG over HDL, triglyceride over HDL ratio, is one of the best parameter for assessing the cardiac risk. And it is one of the best parameter for insulin resistance as well. Because those two parameters, HDL and triglyceride, is out of the 5 parameters which define somebody in either metabolic syndrome or not metabolic syndrome category. And I have seen it in my case that, you know, my insulin dropped when I was dropping my triglyceride, eliminating all these things which I have mentioned, and fixing my D level, because, you know, D is a prohormone. Vitamin D is a prohormone which increases your insulin sensitivity over time. So it's like tackling 1 or 2 parameters at a time and calibrating if need be. A lot of people ask me or talk to me when, you know, within our circles, that, you know, it's very difficult. Lifestyle is very challenging, very difficult. So there are 2 routes. You know, one is God's pharmacy and one is a man-made pharmacy. It's our call to choose. If we go to prescription route and maintain our life balance and maintain our you know, underlying conditions, it's our choice. And sometimes, you know, we don't want to compromise, because, you know, some people, as I've heard before, they say we only live for once. But here, in my definition, it's not about life or death. It's about quality of life. As long as I want to live, which I've been hammering over some time now, as long as I want to live, or as long as I'm going to be living, I want to strive my level best to have the decent quality of life. And it's not about life or death. You know, who knows that, you know, I'm flying and, you know, I died with the airplane crash, or when I sit behind the wheel, when I drive the car, I have an accident and I'm dead, right? So that's beyond my control. Whatever I control, I can underwrite the risk for that, because I don't control life or death, but I do have certain amount of leverage which I control to, you know, have a balance of my lifestyle. And that's the message I want to leave you with. You know, it's your choice. At the end of the day, your doctor can provide you the best health care, but not necessarily he can provide you the health. At the end of the day, you are in charge. Remember my words. You are in charge of your health. Create a partnership with your doctor and have a better quality of life. Strive for it. It needs to be earned. It's not going to come to you automatically. I hope I you know, leave some message in this vlog. And if you have any questions, please include in the comment section. I'll try to address it, and I'll try my level best to see you next week. Excuse me if I'm late by a couple of days, but I'm always thinking about my viewers. Because, you know, this channel is about the community of learners. I'm not a doctor. I'm not giving you any prescription. This is purely sharing the knowledge and based on my experiences and practices. Trust me, it takes time. Goodbye.